Okay, so I'm going to discuss administering oral medications to patients. So first, we're gonna make sure that we're gonna check our orders for our patient. We're gonna check the MAR. I see that one of my patients, Jennifer Hoffman, has an order for 50 milligrams of Metoprolol. So to prepare this, I'm going to go into my facility's medication cart or whatever they use, and then I'm going to see that we only have Metoprolol in 25 milligram tablets. So I'm going to use dosage calculation to determine how many tablets I give my patient, and it's 2. So after I'm going to take the medication and its little foil thing, and I'm going to tear off 2, not taking it out of the foil, and I'm going to put it in a plastic cup. And I'm going to check again that this patient does take this much of this medication, ensuring I do my 3 checks. So then I'm also going to go into the patient's room, and let me think. So I'm going to go into my patient's room, and the 3rd check will be at the patient's bedside before I give the medication to the patient. I also see in the MAR that the patient is NPO, and I know that it's not a big deal to give oral medications with a sip of water before surgery, but I can check with my healthcare provider to make sure that he still or she still wants to do that. Also, before I give the medication, I'm going to ask the patient's name, date of birth, and I'm going to double check while I read their ID band. I'm also going to check for allergies. I'm going to ask the patient if they've taken this medication before, and if they haven't, I'm going to educate them on the medication for its purpose and its use. Make sure the patient doesn't have any questions, anything like that. So then I'm going to do hand hygiene, put on gloves. I'm going to take the medication out of the foil packet and put it in the cup, and ask the patient if they can take 2 pills at a time. If they can't, I'll do 1 at a time. And then I'm going to give the medication to my patient, make sure they swallow it, of course, and then I'm going to document that I gave them the medication, and then I'm also going to document if they have any reactions that we don't want to the medication, and if there is, contact their healthcare provider as well. And also before I leave, I'll make sure they have their call light and make sure they don't need anything else before I go.